Okay, well, welcome everybody. This is the first session of the COVID Hero program, where we're focusing on healthcare workers' empowerment with resilience and optimism. And the kind of motivation for doing this was we saw how we recognized how the healthcare workers are really right now during the COVID pandemic serving on the front lines, serving as, and recognized rightly so as heroes in this fight against the pandemic. However, we also recognize that besides being heroes, all of you are also human. And because you're human, also having to deal with the stress of the situation and having kind of some of the natural human reactions that we all have to those levels of stress. And there's specific skills and strategies that we feel like could be helpful in supporting healthcare workers through this time. And so we put this program together to try to share those with you. So Namik, if you can go to the next screen, we can just go over the really quickly. So just some of the general information that we have to provide that, this is not, we're not providing treatment for any mental health disorder. This is more about skills that can specifically help optimize functioning and kind of optimize your well-being during this time. So if you are in a crisis, there's other numbers to call as shown there. You can also contact us if you need other referrals for other services. Also, we are hopefully recording this to post. And so if so we are missing out on a little bit of being able to go back and forth with you and have a discussion on, what's relevant for you and what's not. So please feel free to contact us if you have any further questions after this or want more information about anything. And I think that is probably it for that. So, since I've said that, I want to introduce myself. So I'm Dr. Robin Aupperle, and I am a principal investigator at Laureate Institute for Brain Research and also an associate professor at the University of Tulsa. Namik, you want to introduce yourself?
Hi, I'm Dr. Namik Kirlic. I'm an associate investigator at Laureate Institute for Brain Research and also a clinical psychologist.
Yeah, I guess I should mention that too. I'm a clinical psychologist as well. So that's kind of how we come at this, is how can we help in this and everything that's going on in the world right now. And so this is where we felt was, that we were really passionate about helping and trying to give back in whatever way we could in terms of supporting the people who are really out there trying to keep us safe and trying to, treat and handle the crisis that's going on right now. Namik, you want to go to the next slide? So we're going to start out with a video because we want this to be as engaging as we possibly can. So we know if we just sit here and lecture, then it's probably not going to be incredibly entertaining or engaging for you. So we really wanted to start off with a video. This video is more focused on how people respond to stress and anxiety in kind of the modern world, say, not necessarily specific to COVID. So as you watch this, I want you to think, keep in your heads, like what about this video might be relevant for the stress that we experienced during COVID, but also what might not be relevant to how, to the current situation. Thinking about that video, the main things we wanted to get across with this was, just kind of the stress response is the stress response. That's how our body responds. And so a lot of things described in the video or shown in the video in terms of our, increased heart rate, just kind of feeling out of control or, having not being able to focus and having problems remembering things and kind of affecting, just our cognitive functions and feeling on edge and agitated. All of those things are true regardless of where the stress is coming from. So kind of the way we respond to stress may be somewhat similar in terms of COVID as they are maybe for other threats. The problem is, so one of the things in the video, they talked about false alarms, where a lot of times in modern world, we might be stressed about work, being late for an interview or whatever it might be. And some of these are false alarms. They're not actually things that are threatening to our physical safety. But with COVID, we actually do have a real threat there that we are responding to. And so it's completely natural to have that response. And in fact, it's adaptive to have some sort of anxiety and stress response when there is a real threat. So I think that's one part that's somewhat different. But another kind of part is, the examples in the video were very quick acute stressors, right? Like with a job interview that's coming up and it happens and it goes, or with an alligator attacking you, that happens, you run, it's gone. With COVID, unfortunately, we're under this potentially chronic situation where it's most likely not going away anytime soon. So we're dealing with kind of this more prolonged period of threat that we can't just run away or fight it and it's done. We have to learn how to function within this new environment and with this new threat. But a lot of the strategies pointed out in here can still be helpful. So some of the breathing, the socializing, the laughing, the deciding on a plan of action. There might just be specific, unique ways in which we have to do that within COVID, right? We can't go to a cafe and be sitting around with 10 other people like it showed in the video. And, we might not be able to do things in the same way. But it still is true that a lot of these things could be helpful. There might not be that as many things that are under our control in order to come up with a plan of action, but there still are certain things that we can have control over. So that's kind of what we're trying to target with this program. Namik, do you have things to add?
I'm going to mention that, we want to acknowledge that through your training and experiences, you might have dealt with, small and large stressors, and you already have sort of say in your toolbox a set of ways that that work for you to and help you cope with stressful situations. This is a different type of stressor. It's quite unprecedented for most of us. We have not been through something like this. And so what's required of us might be different. And so this program really was designed in such a way that we wanted to make sure that we acknowledge the skills and the tools that we have, but also talk about ways that we might have to adapt them or learn new skills just to help us do a better job at coping with the stress that comes with it.
Right. And I think one thing to point out that I didn't in the beginning is, we recognize that healthcare workers are very good at taking care of people. Mm-hmm. And that's what you do for a living. And so there's a lot of these skills and strategies you might know, but I think sometimes as healthcare workers that care so much about other people, sometimes you forget kind of the most important person to take care of is you. And, trying to focus on some of these strategies to strengthen your own skills can be really helpful in terms of not only yourself, but also helping you to help others to be at your best can also help you in terms of your job. Thing to point out about the video is it makes everything seem so simplistic and easy as well. You just breathe a little bit, you exercise, you're good. So I think that's something also that we want to recognize with this program is that we're trying to hone down in on specific strategies and provide ways to actually implement them with the recognition that they're not simple. Like just telling someone to breathe even isn't necessarily just a simplistic thing. So and Jessica, I know since you popped on just now, I did want to introduce ourselves. So I'm Robin Aupperle. I'm a clinical psychologist and a researcher at Laureate Institute for Brain Research and also an associate professor at the University of Tulsa. A lot of my work in the past has been on treatments for depression and anxiety, but also on resilience training for people in general that aren't necessarily dealing with any kind of mental disorders. So we've implemented programs at the University of Tulsa for college students transitioning from high school to college. And so we've thought a lot about not just treatments, but also how do you provide strategies in a way to boost people up just in kind of everyday lives or dealing with a stressor. Namik, you want to introduce yourself?
Sure. I'm Namik Kirlic. I'm also a researcher at LIBOR and a clinical psychologist. Robin was my mentor, and so I've worked on some of the studies that she's mentioned right now. And then also my work right now uses basically mindfulness to help teens cope with stress. So that's one of the things that I'm researching that's relevant for this particular.
And Jessica, since it's just us, I know it'll be more of like a conversation, hopefully, than just a, just a presentation.
Sure.
So, do you mind sharing a little bit about yourself in terms of what type of work, where you're working?
Yes, so I am an RN. I have worked in the ER at main campus for almost 2 years now. And this has been my first full-time job since graduating from nursing school. So I've been doing that. I am ironically really interested in disaster relief and kind of moving towards that as part of my career later on. So this has been a very interesting process to be able to go through somewhat of a disaster situation right here at home with my colleagues.
Yeah,
that's really interesting. You mentioned that because a lot of what this training is based on is interventions basically that were designed to help people in the midst of disasters. So the research that's been done on the skills that we're presenting on has come from that field, actually.
Well, awesome.
Yeah. So if you follow this, maybe it'll be helpful in your future work too, in terms of helping other people. I'm curious what you've seen or experienced in your work in terms of changes in stress levels, or kind of where that stress is coming from too. Like if you're feeling overrun, if how it's going.
Mm-hmm. So at first, I think that we were all a little bit bored. Whenever first people started to go into quarantine, we had a dramatic reduction in number of patients, and we're still seeing a little bit of that. But other than the first few weeks, I don't think that our workload has really decreased at all. And a lot of it is because of the budget cuts, unfortunately. They've been DVing an awful lot of our staff. So we'd only been using half the ER, but we'd only had half the nurses to take care of all the patients too.
Mm-hmm.
So, I mean, we're still seeing about the same patient to nurse ratios as we had been earlier. And quite frankly, those are not always ideal in the TEC. So I think that has been a major source of frustration, knowing that we have a lot of human resources that we're not using because financial resources have become an issue. So that's probably my biggest frustration. But it's been difficult for me because a lot of friends and family are asking me what I think, and I completely honestly do not know. I don't think that we've seen what the news media has been predicting, and yet we do still have a threat with this disease. So I'm trying to find a way to balance out saying, well, yes, this is serious, but I don't think it's been quite as severe as what we thought. Yeah. So I think that's my main thoughts at this point.
Interesting. Yeah. No, that's a great point, because it's like besides, we had the COVID threat, and I think we were all under this anticipatory phase of ramping up and thinking, what is this going to be like? And now it hasn't been as bad as we thought, but there's all these other stressors that go with it that some of us might not even think about, in terms of, like you said, the staff changes, and the social pressures, wherever they may come from. Well, thank you so much for sharing. And please, so this is kind of the introductory session, but as we kind of go through this stuff, please speak up with questions so we can make this definitely more back and forth. Namik, you want to take it from here?
Yeah. So we kind of went through and, let's see what folks were saying about the types of stressors that could potentially, be relevant during this time. And so we have a few categories that we listed, and we wanted to just kind of go over them. And Jessica, I'd be interested to hear from you sort of, I think you've alluded to some of them, but also sort of what seems, to be, potentially true or not. So feel free to jump in. So we have the category of work, and things like increased demand, longer shifts, difficult patient outcomes, shortage of supplies, and uncertainty being potential sources of stress for healthcare workers. And that makes sense, especially in areas and hospitals that might have a greater demand or greater number of cases. But also sounds like if there are places where some of the workers are not coming in, and but you are having the same amount of patients, that again, the demand is greater. Obviously, shortage of supplies can be an issue, but also uncertainty of how this might play out. You alluded to that to yourself. We still don't know how everything is going to, where it's going to go. So, and then obviously difficult patient outcomes as folks get sick. So, all of those things may be sources of stress. At home, you mentioned something that, being a healthcare worker yourself, family and friends are probably asking you a lot of questions. So, but they also are dealing with things like physical distancing and childcare issues for those with kids. So we've heard things like, daycares are obviously closing and schools are closed, but if parents are working full time, then, the question of what to do with kids. Financial strains, folks in the family may, or even you, or maybe having an impact on their income or other financial resources. And then we've also seen, we haven't really seen food shortages, but we've seen other shortages as folks are trying to adapt to the crisis. And then also fear of passing the virus along to our family members, especially healthcare workers who are the front lines, working with folks who do have COVID-19, that fear of getting them themselves and then bringing into their families. And then personally, disrupted sleep. Now, I know that sometimes your sleep schedules can be different than most other folks, but potentially just trouble sleeping because of all the stress, feeling like we're overcommitted to our work. We're also being, again, asked to physically distance, so it may feel isolating. Since we're not able to engage in our social networks as typically as we have, lack of balance, fatigue, and then again, risk of illness to self. So sort of lots on this list of different things that could be going on that could potentially be stressful. I'm curious to hear from you, Jessica, if these things sound right, or from your perspective or experience, or the things that you've heard from your coworkers, or if you'd like to add some.
Yeah, absolutely. Yeah, I know definitely childcare is a thing. The PPE shortage has been interesting. I think we've never been completely without it. So I think that has been a little bit less of an issue, but initially we were concerned. And then we actually just fit tested new sets of N95 masks, and they're not fitting everyone. So that has been interesting. I was trying to say,
it sounds
definitely
like touch and go, right? You guys are working through some of these things.
yes, just a lot of adjusting on the fly, which I think that's something that we do very well down in the ER, because that's just our normal, you never know what's going to come in. But on top, having possible COVID patients as well as everyone else that's still getting sick and injured is an added stressor. And then for me, absolutely fear of passing along the virus. My father is a little bit older. So, I hadn't been seeing him. I haven't been seeing my grandparents. And, even though I can still call them and video chat with them, it's still a stressor, I think, just being concerned, maybe I won't give it to them, but what if someone else does? Mm-hmm. So I think that's definitely something my coworkers and I have been worried about.
Yeah, absolutely. And then again, as much as these seem to be general, we also all will have our own set of individual sort of stressors. And so it's important to recognize those things as well. And I'm sure you've seen this in your training, the Maslow's Hierarchy of human needs. And you might kind of work with it, but one of the things that sort of is interesting is that we sort of start at the bottom of this pyramid and take care of the things that we need to take care of And this can actually help us in some ways cope with stress, because we sort of know the things that we need to take care of, but it can also, it's good to recognize. So, taking care of ourselves and physiological needs. And so thinking about, am I eating enough, right? Am I sleeping enough? Am I doing any exercise? Am I taking my bathroom breaks, right, just to take care of myself? Those are the kinds of things that we want to make sure that we're doing as well. Safety needs. This typically relates to feeling safe in our environment, but it really translates to the situation as well. Do we have enough PPEs and masks? And am I protected, not just at work, but at home and at the grocery store? So, taking care of those kinds of things. And then we kind of, as we go up to the hierarchy, there are social needs as well that are potentially may not be met, right? We're having a difficult time spending time with others, where we're being asked not to. We have all of this great technology, but it's different, and some folks are having a hard time using them, or may not have access to them. So, and then we get to things like self-esteem needs and self-actualization, and these kinds of things may not necessarily be relevant in a crisis, but we're not getting to those things if we are very much involved in taking care of all the other kind of needs at the bottom of the hierarchy. So we could be neglecting potentially some of those things. You might have seen a lot of folks saying, we should be learning a new language and learning new skills, and that's great if we have the time and resources for doing that. But if other needs are impacted, then we may not be getting to those. And as healthcare workers, you might have actually, you're used to spending time taking care of those needs as well. And if you're noticing that they're being neglected, that in and of itself could be a potential source of sort of stress. But it's good to kind of recognize this and look at the hierarchy and say, okay, what are the things that I need to make myself survive and stay safe, and then I can move up the hierarchy.
And I think when we developed this program too, we kept that in mind in terms of we didn't want to be piling all of this stuff on in terms of I don't know, becoming your best existential self, and like this whole, like just optimizing every single bit about ourselves, right? Like we're not doing 2-year-long therapy in terms of trying to optimize our whole life right now during a threat like this. Instead, kind of really trying to focus in on, okay, what are my specific psychological needs right now? What are my specific physiological needs that I specifically need to focus on? What are the pieces that I feel like are crucial for me? And so, rather than trying to tackle the world right now, really focusing in, does that make sense, Jessica?
Yes, absolutely.
So the first sort of step in this program and in our approach, this really is to identify priorities in managing the stress resulting from COVID. So we thought through some potentially expected reactions to heightened stress in general that are also relevant to this very situation. So one is difficulty managing reactions to upsetting events. And I should say that a lot of these can come from the fact that over time we can become, with stress, we can become fatigued, and we may be less effective in utilizing the skills that we have. So just recognizing that these are the things that might be coming up. So again, difficulty managing reactions to upsetting events, difficulty connecting with friends and family for support, feeling down or withdrawn from the world, or just simply not having enough of positive experiences, either because of the circumstances that we're finding ourselves in, which is definitely the case, but also sort of how we might be feeling. Having upsetting thoughts pop into our minds. So in this case, it's like, well, what if I got COVID-19 today at work, or something like that, or what if I pass this along to my family? It's just anxiety driving or provoking thoughts can be very upsetting and pop up into our minds. And then facing specific difficult problems that need to be solved. So something like, okay, do we have enough masks and PPEs, and how do we go about getting them? And so it's expected that we will have these responses. It's expected that during these type of events, we will have these responses. And so the question then becomes, what can we do to help cope with each of these? And so before we jump into talking about how the program will address each of these different areas and how the sessions that are forthcoming will be designed to address each of these areas, we have another video we wanted to show that somebody did a very clever acronym that says, basically said, face COVID. And it's an overview of different strategies that can be useful during COVID-related stress. As you're watching, Jessica, think of the ways that you might be able to use some of these strategies, or think of different ones, or the ones, some of these might be the ones you've already used. So yeah, give it some thought, and then we can discuss. But the program, it will actually cover some of these as we go forward as well. So let's see if I can make this.
I'm just curious kind of what your first impressions are of that video and how, like, you know, whether there's things you've used or things that seem irrelevant or anything.
Yeah, I really enjoyed that. I definitely like the fact that it incorporates a lot of mindfulness techniques. I mean, it's very simple, and I think that's what we need. It's something that's simple, and you know, I don't know that I would be able to remember all of those steps just from watching it once, but you know, I feel like if people are able to pick out, like, okay, this is what I can do, you know, here's at least one or two things, and just start there. I think a lot of times when we're facing a situation that's complex, it's so easy to get overwhelmed, and you know, if you don't know where to start, a lot of times the temptation is there to just sit and wallow. But you know, if we can just think of one place to start, you know, it'll be a lot easier to keep moving forward and not get stuck.
Absolutely.
Yep. Yeah, absolutely.
Yeah, that segued great for us.
Absolutely right. And I think that's really sort of what we were hoping to do, is to, you know, and when we were actually thinking about this, we thought, you know, is there an order to things? Is there a progression of how sessions should go? And they will go in whichever way they go, but there isn't, you know, it isn't what, you know, learn and master this skill and then move on to the next. It's really sort of find what works, what seems to fit, and then also from situation to situation, what might be the most either relevant or most useful, or easiest at the time. So, well, we thought that.
Oh, sorry, Namik, I was just gonna say, yeah, so, and this might, I hope I didn't just steal everything you're about to say, but yeah, so with that video, like you said, it has, I mean, it kind of boils it down a little bit, but there's a lot of things in there where, like you said, where you could pick to start. And so I feel like there was a lot of overlap between what's in that video and then what our sessions focus on. But each of our sessions try to drill down just to like one specific aspect of it and focus on just that, to get people, like you said, you know, have people really focus on just one thing to start with and just that thing. And so the hope was that people could kind of pick which of those things they wanted to focus on and start with. And we would drill it down on that. Sorry, Namik, go ahead.
So, you know, mindfulness came up in the video and you mentioned it as well. And so, you know, difficulty managing reactions to upsetting events. We thought mindfulness is something that can be used for that, you know, because it, you know, mindfulness is about being present in the moment and noticing really what's happening with us, you know, the kind of things that we're thinking, the feelings we're having, the physical reactions we're experiencing, and then choosing the course of action, how to deal with those reactions. And so, so mindfulness will be something that we'll go over. We'll talk about how to build and maintain healthy connections during COVID. We'll go over some skills regarding that. When it comes to feeling down or withdrawn from the world, we'll talk about enhancing positive emotions and meaning. And this will, as the video also alluded to, we'll kind of think through what are the things that are important to us, how we like to structure our lives, what are the kinds of things that we know enhance positive emotions, and then coming up with concrete plans on how to engage in those activities or engage with those people to basically, again, make sure that we are experiencing positive emotions. We'll also talk about how to combat those negative, upsetting thoughts that might be popping up into our head, and what skills we might be able to use to, not just notice those thoughts, but to either reframe them or provide sort of some different way of dealing with them as they come up. And then finally, we'll talk specifically about how to recognize problems, think through them, and then come up with strategies to work through those problems, and all with the goal of enhancing resilience as we're facing those difficult problems. So that's really the overview of the program.
So just kind of curious because those are, that's kind of the end of this session, is just kind of the intro to all this, but with those 5 sessions we have listed there, just in terms of your experiences or kind of your knowledge of kind of other people's experiences in your work, which session do you feel like people would gravitate towards the most?
Oh, that's a good question. Honestly, I would say probably problem solving. A lot of my coworkers are very practical down in the ER.
Yeah.
I'm very interested in all of these. I'm looking at some of them and thinking about some of my coworkers. I'm like, they might think that some of it was silly in a way. But I think that's also because there's a lot of disillusionment going on in the ER right now. And that's something that I've experienced for myself a little bit as well. But I think, maybe facing even that as an issue as well. How do I deal with being frustrated in my line of work, but not letting that keep me from adapting and finding healthy ways to cope in spite of, multiple layers of what I would view problems that I'm facing. So I think that's what stuck out to me the most, probably the last one. But they do all, have a valuable place.
And so when you say disillusionment, you mean kind of like the cynicism or bitterness with kind of just it not being the way people expected it to be, or not having enough support, or?
I think so. In emergency medical services, there is a lot of cynicism to begin with. I think even in just a normal situation, it's the emergency room, but people are coming in for toe pain, and not everyone is respectful and agreeable, and you will get that anywhere in the hospital, but there's an awful lot down in the ER. So we have that, and then we have this pandemic come up, and we're facing the challenges. And I think for a lot of us, it feels like, maybe the upper levels of administration are not supporting us like we would like them to, with having to send staff home. That's not something that my manager wants to do. But nevertheless, it is happening. And I think a lot of people are just angry, that we're being, what feels like set back in this way, not protected, not being allowed to fully help each other out because we can't all even be there. So I think that seems to be the overarching theme in the TEC specifically, is just lots of frustration and lots of anger with the way that the situation is being handled on an administrative level. But again, going back to the FACE COVID acronym, focusing on things we can control. We can't control, whatever board of directors is doing. We can speak up about it, but in the day-to-day operations, you really have to focus on, well, this is how many people we have today, and how are we going to make that work, because it's, some things are not going to change, and you just have to adapt the best that you possibly can.
That's extremely helpful, because yeah, I mean, because even from our perspective in terms of providing these, because if we could change the administration, we would we would just do that. But then given that, like how can we, because I think a lot of these things could be useful given that, but I think we haven't actually thus far had that as much of a prominent idea in our heads of what people are dealing with, which it makes total sense. Like now that you say it, I'm like, oh well, we totally should have had that in our in our minds. But a lot of the in terms of managing reactions with mindfulness, I think can be incredibly helpful when we're feeling irritated and frustrated by some of these things, to kind of focus in on the present moment rather than kind of the shoulds and the why not kind of things. And obviously a healthy connection, because you alluded to, it was kind of interesting, you alluded to trying to support each other even when not everyone's there. And figuring out ways to do that, might be something that we could, sprinkle into that healthy connections during COVID. And enhancing, positive emotions and meaning is kind of that's where, some of, that I really gravitate towards. But yeah, in terms of, finding meaning, even when the patients themselves are being, ungrateful or that are being frustrating, how do you still find meaning in your work when all of the feedback you're getting is not reinforcing for that? And so, and like you said, problem solving, and I think helpful thinking, all these things can all be useful in terms of those experiences, but I think that's really useful information for us to have in terms of recognizing that is one primary obstacle. And it's an obstacle, like you said, not even just during COVID. So just in terms of healthcare worker burnout, that's always, that has become an issue because of all of these things, because of the lack of support and the being overburdened and too many patients and not enough staff and, all those things is an ongoing problem. So yeah, anyway, that's very helpful. Thank you, Jessica.
Absolutely.
Namik, do you have anything else to add?
No, I just thank you again, Jessica, for being on here and helping us through this and guiding us a little bit.
Yes, absolutely. Thank you for allowing me to join. It's been great.
Yeah. So what the plan is going forward, so originally they sent out the invites to select units. I guess obviously it started with ER, but I think specifically nurses. But then since we didn't have as many people sign up as what we would have hoped, so they're going to actually broaden it out and just blast everybody, like the whole healthcare system, including OSU Medical Center, I think. And so we'll be doing this session again, just the intro session, next week. At some point. So, I know you might not want to listen to that again, but definitely spread the word, if you think it'd be helpful. We'd love for a lot of people to sign up. And then after we do that, hopefully, for a larger group, we'll continue on with these other sessions as well. So just watch your email invite for the other ones. And hopefully we'll see you on here again.
Absolutely. I love that.
All right. Well, thank you, Jessica, and good luck with the rest of your day.
Thank you, guys. Have a good afternoon. Bye.
Okay. Bye.